ever wonder how much sun damage your skin has suffered, or if that skin treatment you've been getting is actually working? Well, La Dermique offers a procedure that will actually show you a closer look at your skin. Kelly Ivy Subak is a patient consultant at La Dermique in Feeding Hills. She's here to share more about the Visia complexion analysis. Kelly, so nice to be with you.
Always nice to be here.
Now, the Visia complexion analysis, I know we've talked about it in the past, we've shown it, but to really get into what it can show you is what we're talking about today.
Yes, so it is a diagnostic tool for my industry to figure out what's going on with each patient, because really by having them come in and just looking at them, you really have no concept of what has been going on underneath their skin for the past 40, 50, 60 years, and we don't see that until we go through the time of it. So to be able to have a tool that I can actually look in and find out how much sun damage there is, how they compare to their peers, because I can't judge a 20-year-old to a 60-year-old. They all have different issues going on. So this tool really allows me to figure out where that patient should be in their age group and what we can do moving forward to get them to the ideal improvement for their age.
Yes, and it makes sense to do that because as time goes on, your skin thins out and all those things that are under there are eventually going to be seen.
Everything kind of moves forward in time. As the skin thins out, as the sun damage moves to the surface, we go, oh my God, what did I do when I was 18?
I'm already saying that. What did I do when I was 18?
Exactly.
And I'm not even 30. So anyway, this is a great way to know what you need to do to take care of those problems and tackle them before they come to the surface. So you have gotten the Visia skin analysis. Now this, by the way, let's mention, is something that is free when you come for a consultation.
Absolutely. It is to figure out what we're going to do moving forward so that you get the ideal results. So we're not just throwing ideas out there. Well, maybe this will work, or maybe that'll work, or let's try a chemical peel. We really know that that's going to be the treatment that's going to get the best result for you.
And then you can get the analysis later on to see the difference.
We do it, yeah. At about 60 to 90 days, we redo it so that we ensure that the procedures that you're doing are getting the results, and that we're not throwing good money after bad, and that if I say it's going to work for you, it's working for you. And if it's not, that's my responsibility to figure out what will for you.
So let's take a look at your face in the Visia complexion analysis. So obviously looking at this, it looks like you're just glowing in the dark. So you tell me, what am I looking at?
So right now we're looking at what's called paraffins, and it's the presence of P. acne bacteria. So when a patient comes in, even if they're not acneic, if there's lots of those little glow-in-the-dark, that means that all those pores are clogged to me. So that means we need to clean that skin out and get those clogged pores cleaned out.
Okay, so
if it's an acneic patient, then I know how to treat the acne depending on how much bacteria they have.
Got it. So it's giving you exactly what is happening underneath the surface. Let's look at the next photo and let me know exactly what this is showing.
So this is my 39 years of Florida sun damage growing up in South Florida. So it should be that very light color that I only have on the very hairline, but unfortunately I am 100% brown. So what everybody says to me is, oh, you have beautiful skin. It's more like, no, I'm a really good makeup artist. I don't have that great of skin that I'm always working on. I'm always trying to improve that sun damage. So when I have a patient who comes in and they may have beautiful skin to the surface, you never know what is underneath that. And if I were to ignore that and let it come to the surface when I'm 60, I'm not going to be a happy camper.
Right, so you'll know exactly what people need to take care of that. Let's look at the next photo. What are we seeing here? It's a little bit harder to see this one. It looks like little blue dots all over your face, little aqua dots.
So that one is of my pore size.
Okay.
So it's telling me which pores are enlarged beyond their normal scope, what they really should be. And that, you know, pores enlarge for two reasons. Either dehydration, there's no water in the skin, and the pore opening, the ostium, dilates itself to try to get water, or too much oil production. My case tends to be a little bit of both. So,
but everyone's different, so you'll look
everyone
at
is different.
Let's fly through these next photos pretty quickly just to see, what are we looking at here?
Sensitivity, blood flow right underneath the skin that tells me if a person can handle a chemical peel, if they have rosacea, if they've got some kind of vascular issue that I can't be super aggressive with.
Aha.
So and I do have sensitive skin because you can see the redness in my cheeks.
So be careful with Kelly. Okay, and then what are we looking at here?
That one is for texture, so highs and lows, kind of a pore sizey issue in some of the lines, fine lines and wrinkles. People come in and they say, oh, I've got so many wrinkles. Sometimes they're not wrinkles, they're lines of dehydration. The skin is just dried out, and because of movement And just like a piece of leather, you move it, it creases. If you put water into it, it goes away. So sometimes they think they have a wrinkle, but it's really not a wrinkle.
Oh, you just got to slap on some moisturizer.
Well, it's a little more in depth than that, but yes. So these are my wrinkles. So you can see that, you know, everyone's, oh my gosh, you don't have a wrinkle on your face. Well, that is hooey, because obviously I do have quite a few wrinkles. Most of mine are lines of dehydration. It's summertime, too much outdoor exposure. I have a convertible. There's too much wind in the hair, breezing around.
So then you know what you need to do for someone, and you really can target exactly what they need. Now, Kelly, we're out of time, but we're going to track you as you go through procedures and take a look at before and afters of underneath your skin.
So I'm doing the 90-day challenge, what we do for other patients. And so I have 90 days to get my skin to the best result it possibly can be. We do this for patients, so I'm inviting people in if they want to participate. They can start their 90-day challenge and get them the best skin before Christmas. So they'll look amazing for the holidays.
Free consultation with Kelly,
yes,
so they can come in and see you. Thanks, Kelly.
Thank you so much.
And if you want to know how you can get that free consultation, just call them, 413-786-3376, or visit LaDermique.com.